afternoon. I know it's a really heavy news day today as it relates to COVID-19 in the state of South Dakota. Let's start with Smithfield and Sioux Falls. I've been in very close communication with them, the Smithfield president, Ken Sullivan, over the last 24 hours, and I will repeat for the people of South Dakota that the health and safety of the Smithfield employees and the community's public health is paramount. I was very appreciative of the decisive action that they announced this morning, the steps that they have already taken, and they care a lot about their workers and their families, and this is a difficult time for everyone. Over the coming days, Smithfield is going to be taking additional steps to protect its workforce, especially those that are most vulnerable, to protect them from this virus. The plant will temporarily shut down for a few days. They're going to repeat some of the rigorous cleaning activities that they have been doing for quite some time. They're going to add some new physical barriers to the structure to promote further social distancing, and they're going to provide paid time off for their employees with a COVID diagnosis or that are in quarantine because they could potentially have been exposed to it. As all South Dakotans know, we take great pride in feeding America. From our farms through plants like this to your table, this is something that South Dakota does, we have done for generations, and we're very proud of the fact that that is a role that we play in our national security. This plant in particular supplies 130 million servings of pork per week, or about 18 million servings per day to our country. A pandemic like this can get a lot worse if we can't feed our people. And so I do appreciate their commitment to doing the right things and the steps that they've actively brought forward, and we'll continue to work with them. The Department of Health will be working closely with Smithfield leadership and the plant management to make sure that all CDC guidelines are followed both inside and outside of the workplace. And then speaking of outside of the workplace, I want to speak about an additional tool that we're launching today. And I want to reiterate, despite this tool, the best advice that I can give all of you, what I am telling the people of South Dakota, is at every opportunity to please stay home. But we also recognize that we've got a lot of folks that have essential jobs. They work in critical infrastructure. They're healthcare workers. They may be producing our food. They may have to do things for elderly and vulnerable populations. Everybody needs to go do some of those things. So one thing that I have worked with the governor of North Dakota on and his team is to develop an app that they have laid out that we are going to participate in that's called Care-19. This app will use location services, just like other apps that are on your phone, and it allows users to keep track of where they have been in the community. So if you're in the unfortunate situation where you test positive for COVID-19, this is an app that will help the Department of Health work with you to remember all the places that you've been, the people that you may have been near, and will help us more efficiently investigate your case. We spend hours and hours with our team at the Department of Health going back and helping people remember where they've been, that they could have put other people at risk by exposure to the virus. This app will do all of that and provide that type of history that will be incredibly important for us as a state to slow down the spread of the virus across the state of South Dakota. Now, it's completely voluntary. You can opt in, download the app, and sign up for the contact tracing, the location logging, provides a way to stay informed on potential exposure. All of the people that are using this app will be completely anonymous. The data can't be used for anything else. You can opt out at any time, and you can erase all of your data at any time that you would like to. I'd like to encourage everybody to go visit covid.sd.gov and download the Care-19 app on your phone. It is available today, and it does have a South Dakota choice that you need to make inside of that app that will allow you today to start recording where you've been in case you do have exposure in the future. We're hoping in the future it'll also help us identify and send messages to those who potentially could have been in close contact with positive cases. And we'll continue to see how we can utilize this app to give you information that you may like. But just know that is available today. It's called Care-19. If you can't find it in your app store, certainly go to covid.sd.gov and you'll be able to find it there and download that app to start tracking your history. That'll be helpful as we go through this situation in our state. Today, I had phone calls with all the mayors in the state. I had phone calls with the county commissioners. I talked to many of them about how important it is that they drive home the message to continue social distancing, that we need to make sure we're reminding our communities that we need to sustain these activities up until July, beginning of August, that we'll still reach our peak in June sometime, and that this is a marathon, that it's not a sprint. And I talked about our projections, the economic impacts that we're seeing across the state, and most of them were expressing grave concerns for their small businesses in their towns. They said people are really struggling to pay their bills. The businesses were having a difficult time keeping their employees in paid and paychecks going. I encouraged all of them to check out the Governor Noem disaster assistance loan that we have through economic development. We approved some of those loans already and are going out the door to help South Dakota small businesses cover some of their bills, and we also are giving them information on how they can contact their financial institutions to access the payroll protection plan that came through some of the federal stimulus dollars. There are resources. We do have information on the COVID website, and I encourage those local leaders to continue to go there to access information to share with their communities. Speaking of business concerns, I want to talk a little bit about what we're seeing for unemployment claims. From March 29th through April 4th, so this was last week, we had a total of 7,916 claims for unemployment that were filed. That's an increase of 1,115 over the previous week. If you remember the previous week, we had 6,801. Just this last week, we had 7,916. For perspective, prior to this COVID virus hitting our state, our average was about 150 to 180 claims a week. And again, last week, we had almost about 8,000. We are issuing the additional $600, which was extended unemployment benefits that came because of the CARES Act that passed through Congress. Folks do not need to do anything special to access that $600. All they need to do is fill out the regular weekly request for payment, and they will be able to get the additional $600 that will come. I want to drive home the point that these numbers are historical in our state in the very worst way. I don't think we've ever had data that has been quite this bad in the state of South Dakota. So while we are in unprecedented times and uncharted waters, what continues to encourage me each and every day is the stories I hear from our communities. The kids, the teachers, the families that are coming alongside each other and sharing thoughts and words and encouragement. I just know that when we get to the end of this, we'll be better people for it. We'll be closer, and we'll recognize the blessing that we have of living in South Dakota. So with that, let me open it up for any questions you may have. These numbers are historical in our...
So yesterday we said more than 80 Smithfield employees had tested positive. Do you have an updated number today?
This is Kim Alston-Reisen with the Department of Health. We do not have an updated number. We're continuing to investigate all positive cases, including contact tracing of those positive cases, but I don't have an updated number for that cluster.
Know that when we get to the end of this, we'll be better people. We'll have one more question in the room, and then we'll go on to our phones.
I'll go, Governor.
Sure.
And actually, I guess a question for the Secretary.
Sure.
Is there a concern that with as many people being exposed at the Smithfield plant as there is there concern that any of that virus could have gotten into product that would be shipped out of there?
So the question is around exposure of the virus to other products or food products. We do not have that concern at the Department of Health. And again, we will continue to work with the management and folks at Smithfield to ensure that moving forward that's not a concern in the future.
Thank you.
In relation to the unemployment numbers you mentioned, and in mentioning them that they were historically bad, how far back do your statistics measure? I mean, does that go back to like the Great Depression, or I mean?
We can get that for you. I don't have a specific date, but yeah, if you want to write a piece on how far back that goes. But since we've been keeping track of unemployment claims and since it was first put into place by the federal government, I would assume that's as far back as it goes. Yes, if everybody on the phone could mute your lines when you're not asking a question, that would be very helpful. Let's go to a question on the phone. Do we have a question on the phone today?
Governor, this is Stephen Groves from AP.
Yes.
Did you encourage Smithfield to have the temporary shutdown in your conversations with them?
You know, we talked several times, Ken and I, the last 24 hours, and had great conversations about different types of action that they were thinking about taking and what we could do to be helpful. You know, this morning we talked again about what the plan was, and I agreed with it and thought it was appropriate. So we'll continue those conversations. They've been real leaders in what I'm impressed with is their number one concern is they care and they love their employees. And they're concerned about communicating with them as well so that when they leave their building and they go home with their families, that they're protecting them in the community too. So I think this 3-day shutdown will be helpful. It'll allow them to do some more mitigation measures as far as putting in some protective equipment to make sure they're social distancing and that they also have the opportunity to repeat the rigorous cleaning that they've been doing and get back up and rolling again next week. But they are giving paid time off to their employees, and they took their vulnerable population and asked them not to come to work as well to protect them and their health.
Would it be appropriate to declare a public health emergency for cases like the man in Chamberlain, Owakoma, who is knowingly spreading the virus in order to give officials the tools to isolate him?
So when we have an individual that is not complying with direction and is potentially putting other people at risk, we of course get very concerned about that. We take swift action. We typically will issue a public health intervention order, and we have the statutory authority to do that. If we go to that step and a person doesn't comply with that order, which is an order from the Secretary of the Department of Health to take certain actions, then we would consider issuing a public health emergency. And then what that does is it allows for a judicial enforcement of that particular order. So we will use all the tools available to us to handle any specific situation where a person is not doing what they need to do. And as of this point, we have not had to issue a public health order for that purpose.
This is Trevor Mitchell with the Argus Leader.
Yes, go ahead, Trevor.
Have you or anyone in your administration reached out to other leadership at South Dakota food production plants to talk about measures they may be taking in advance to try to head off something like Smithfield happening with them?
Yes, I would say that for weeks now we've been in communications with all of our businesses, their environments. We've given them recommendation on how they can be innovative to care for their employees. The Department of Health has been in contact with them as the one giving some clarity to CDC guidance that they could follow in their workplaces. So I've been very impressed with actions that South Dakota businesses have been taking to protect their workforce. And the Smithfield situation is a difficult one, and we're going to continue to do all that we can to make sure that the situation is rectified and that people's health is protected.
Do you feel as if the
I think we lost that question. Let's see if there's another one on the phone.
Yeah, Jeremy Siegelberg, Foreign News Service.
Go ahead, Jeremy.
Yeah, just a question on releasing coronavirus information and recommendations in languages other than English, especially considering the diverse population in the Smithfield plant. Is that something that you're considering doing at the state or local level?
Thank you for that question. This is Kim Malsom-Rice. And so whenever we have a person who does not have English as their first language, we work with interpreters as needed to help do the work that we have. We routinely issue guidance that we put out in other languages, and so we work to make sure that people have the information that they need in the language that they use.
Governor Lee Stribinger, SCTV.
Yes, go ahead, Lee.
I was just wondering what your message was to local leaders today about the state's approach. I think last week they were calling for a little bit more direction and a public health emergency. So what was that message about how the state is approaching this pandemic?
Yeah, we talked about the letter that they'd sent me, that it was the second one I had received from the Municipal League and county leaders, and that I had attempted to address the issue that they were talking about as far as giving them some more authorities during the legislative session, that I and my staff had drafted a bill and brought it forward on veto day that the legislature did reject. And so in light of that, we were looking at other options. That I also described to them and clarified what a public health emergency is and when it would be utilized, and that the fact that the emergency declaration statewide that I've already put into place is much broader, and it gives me much more opportunities to address the situations that we're seeing across the state. So many times public health emergencies can look different from state to state, so I clarified with them what a public health emergency was, what it did, how it was used in much more specific situations than what it might be utilized for in other states, and that the emergency declaration I had in place already was giving me broad authorities to utilize mechanisms that we could use to protect the public health.
And if I could follow up, I guess how would you describe, I guess, the approach that the state is taking? Is it looking at individual communities and responding on an individual level as opposed to sort of like a statewide mandate as has been previously talked about?
Well, I would say it's both. There's many of the directives that I've given, executive orders that I've given that have been statewide. The executive order that I just signed on Monday is a statewide executive order giving direction to individuals what they should do. No groups over the size of 10 in the state of South Dakota. They should continue social distancing. Directions to businesses on how they should be operating if they're continuing to keep their doors open. Pretty clear that that is a statewide approach to what everyone in South Dakota should be taking seriously for protecting public health. The other executive order that I signed on Monday was very specific. It was specific to Minnehaha and Lincoln County, to a specific population. That vulnerable population, those older folks, they need to stay home for the next 3 weeks. It gave clear direction on that, and that it was to protect their health so they wouldn't end up in the hospital. So I'd say, Lee, we're using both tools, and as this continues to change on a day-to-day basis, as we learn more about the virus, as we hopefully get therapeutics that come online in the coming weeks, we will make adjustments as necessary.
Governor, what would you say is the number one thing you need tomorrow, this week, in the foreseeable future? What would you ask for?
I would ask, there's two things, Patrick, I would ask for as top needs today. Gosh, now I'm thinking of more. So when you ask me to be specific, I can't. The number one thing is I need everybody to understand their role in this. This is a big personal responsibility issue, that everybody has a role. And if you are scared and you're worried about your health, you have every opportunity in the world to stay home and protect your health. That is something that is a choice you all have and a decision you can make when you wake up in the morning that will protect your health and your families. The other things that I would like to have is I'd like to have more testing so that we can go out and make sure we're identifying and stopping hot spots faster. And the third one is therapeutics. I've made a request to the federal government I want to run a therapeutics program statewide in South Dakota. I think we're the only state that can do it effectively. We've got healthcare partners that want to do it with me. So I've asked them to help us with that, and I'm hoping they come on board and do that.
We heard that some inmates, or people rather, were being quarantined at the Springfield prison. Is that true? Have you had information on that?
I can tell you that we do not have any positive cases of COVID in any of our state institutions or penal institutions. To the degree a person would have symptoms and we would be doing tests, those individuals would be quarantined until we know their test results, and that's standard practice.
Governor Noem.
Yep, we had a question on the phone. I think, was it Megan? Morgan. Are you there, Morgan? Okay, let's go to the next question. Bob?
Two quick questions. One, do you plan to extend the emergency order? And secondly,
Well, the first question was if I intend to extend the emergency order, and I expect that we may. So I wouldn't be surprised if I do that in the coming days. The second one was in specifics to areas of the plant at Smithfield and Sioux Falls that there might have been people in close quarters where they could have been exposed to the virus. I would let Ken and his team address that question. They probably would know that better than I would, as I have not been inside the plant, especially since they've done some renovations.
Do you have any updates on these National Guard hospitals? I mean, are they making any progress, as well as your progress in acquiring ventilators?
Yes, I think we're making good progress. The National Guard is continuing to work on laying out that plan. I think in the next couple of 2 to 3 weeks, they'll be working on specifics of setting up those hospitals and exactly how many beds will be in each location. If Kim has specifics, I'll let her speak to that too. But they're making good progress on that, and I anticipate that we'll be in great shape weeks before we actually reach our peak.
The ventilators as well? Or?
We do. I'm pursuing several different options. We have some opportunities to get some alternative equipment that may be a good backup for us while we secure more ventilators, and we've got a lot of great feedback that we'll be able to secure some in plenty of time before they're needed.
I don't have anything else to add other than I know the assessment process for where those National Guard hospitals will be is still ongoing, and so we're hopeful to have more of those details early next week.
Is there any more questions on the phone?
This is Stephen Groves from AP.
Okay, go ahead, Stephen.
When were you made aware of the outbreak at Smithfield?
Well, our Department of Health has been working with them for some time. I first had a conversation with Ken, the CEO, about 24 hours ago. Yesterday, we had several conversations and was glad to see how they've handled the situation, and we'll continue to work with them.
Governor,
Okay.
taking that
If you have follow-up questions, somebody's trying to ask one, but it keeps getting broken up. Sure, reach out to Maggie in my office, and we'll make sure he gets you the answer that you need. Thanks so much. Have a great day.